So I think from a firefighter perspective, we're very concerned about how people deal with a burn injury. So if they've been burned by a flammable liquid, we're concerned that they know exactly how to deal with that burn. So what are some things they can do right away to try and stop the burning and also make sure there's a better recovery?
Yeah, it's so important to immediately stop that burning process. And so in the case of a flame burn and a flame burn with flammable liquids as well, stop, drop, and roll. So they need to smother the flames and just keep rolling until the fire is out. The longer that the flame is in contact with their skin, the more severe the injury, the deeper the burn, and the more likely to require surgical management and a prolonged hospitalization. And the more likely that the injury can be life-threatening. So it's really important to initially focus on stopping that burning process.
So part of our response is we can pour saline to cool it or other cool water. What else can be done?
Yeah, I mean, that's the next step, the flames out and then cooling the burn, because there is a period of time where the burn will progress in depth if that heat stays within the skin. So cooling with cool water is ideal. And if there isn't a clean, cool water source, using whatever you have can work. So for example, just using the dog's water bowl or a drink that somebody has to try to cool the skin. We can clean it later.
Okay, and any concerns with cooling people? Is there too long you can cool them for, or is there too much water?
Yeah, particularly in the case of larger burns and particularly in children, we have to be very careful with hypothermia. So the burn injury makes them at higher risk of hypothermia because the skin plays a critical role in maintaining body temperature. And particularly for children, because they have a higher surface area to volume ratio, they can become hypothermic. Their temperature can drop very quickly, and that can be very dangerous. So once the cooling of the burn has taken place, making sure to keep someone warm, so wrapping them with blankets or jackets, whatever is available to try and maintain that body temperature is critical.
Flammable liquid burns, we know, can be so much more dangerous. And besides burning your skin, how else are they dangerous?
These types of injuries can also be associated with injuries to the airway or inhalational injuries. Because you have that massive flash of flames, or in some cases explosions, there can be a thermal injury, but also a chemical injury to the airway. And that has the potential to make people very sick, to require, in some cases, intubation and mechanical ventilation and care in an ICU. And it increases the chance of someone not surviving from their injury.
So if you've had an inhalation burn, obviously that's incredibly severe. The response to that would be immediate medical response. I would suspect calling 911, following instructions of the 911 operator, or getting yourself to a medical facility immediately.